Hi, would it surprise you if I tell you that results following spine surgery are less satisfactory amongst patients who also happen to be chronic smokers? To understand this, let us see what is the impact that smoking has on your spine health. Smoking predominantly affects the lower lumbar spine and specifically affects the L5S1 level. It does so by two mechanisms. One is the direct toxic effect of nicotine on the intervertebral disc, affecting the nucleus pulposus and the annulus fibrosus. And the second mechanism is that it reduces the blood flow to the lower lumbar spine by its vasoconstrictor effect. The entire gamut of lumbar intervertebral disc disease, be it lumbar disc herniation, spinal stenosis, and spondylolisthesis, has been associated, impacted, and worsened by smoking. Smoking, as you know, also has medical comorbidities associated, which can result in impaired wound healing and decreased blood flow to the proposed site of surgery. The impaired wound healing may be restricted to the soft tissue, which is the skin and the muscle, but it may also affect the site of fusion. Fusion surgery is something which is reserved for the most severe forms of degenerative disc disease, which may be associated with instability, and these are the cases in which the patient may need a second surgery if fusion surgery fails. Pain perception is also found to be an issue amongst people who are chronic smokers. Their requirement for opiate analgesics may be high. All these factors result in decreased patient satisfaction, the need for longer convalescence, and a need for higher opiates, and a need for a second revision surgery are important factors. So what should you advise a patient who is a chronic smoker, has a spine condition, which has been advised surgery? My first advice would be that he should make a mental note that smoking has been a factor which is modifiable in his case, and that he should quit smoking at the earliest possible, at least for 4 to 6 weeks before the surgery, because most of these surgeries are not emergency surgeries, and after a good outcome following the surgery, he should make a determination to quit the habit completely so that he does not require additional surgery at the same level or at a different segment of the spine